So now we get to look at another complication of what? Gonorrhea. So if you have gonorrhea, it can go on to now affect the joint, cause inflammation of the joint. So when it causes inflammation in the joint, you call that gonococcal arthritis. Gonococcal arthritis. All right. Arthritis change in right knee. Culture of fluid test positive for gonococci as a microorganism causing the gonorrhea. So gonococcal arthritis, we say that is a form of septic arthritis and is caused by what? Neisseria gonorrhoeae. So it's the most common type of what? Septic arthritis in young and sexually active adults. So you get gonorrhea and it results into this. So it's usually coming from disseminated gonococcal infection. All right. So what's the pathophysiology? Dissemination. So the gonococci is one that is spreading from genital tract infection. It gets into blood. It track up to your joints. So joint involvement, the bacteria will now invade the synovial membranes. It will now cause inflammation in the synovium. There's also purulent effusion. Immune response, it leads to synovitis, cartilage destruction, and also pain. You know, all right. Disseminated gonococcal infection causing gonococcal arthritis. So clinical features is acute arthritis where there is sudden onset of pain, the joint is swollen, the ankle is swollen, the elbow is also swollen. Polyarthritis, you can have the inflammation in many joints. Associated things, you can have polyarthritis, Tenosynovitis, dermatitis where there's like inflammation of the skin and all of that. There's fever, there's malaise, and there's also chills. You diagnose this from, all those histories. You see that the person is young, usually, sexually active and all of that. So also synovial fluid analysis where you now be able to pinpoint the gonococci, also culture. So management is antibiotics. So the antibiotics that is very effective is what? Ceftriaxone. Also joint drainage. You do aspiration, do arthroscopy, then partner treatment. As you are treating the person, you are treating their partner too. Because sometimes you might end up treating this person, they go back, they have the same sex with the partner, and they still come down with the issue.